This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Oh, I believe they're here now.
Oh, perfect. Thank you. Glad it worked. Hi, Dr. Diamond.
Hi, thanks for having us. I think we have a few faculty who are also trying to join, so they're in the process, but I was going to go ahead and get started. I wanted to welcome everyone and thank everyone for their interest in the newly accredited WMC PM&R residency program. It's a 4-year categorical program, and we're extremely excited to offer this incredible opportunity. We're going to give you a quick overview in the next 10 to 15 minutes. We'll try to make it brief so there's plenty of time for questions. We are going to be accepting for this match 4 PGY1 positions and 4 PGY2 positions. That'll be the only year that we're accepting people into the PGY2 year. And after that, we'll be purely categorical, applying at the intern level. Let me start by introducing myself. I'm Dr. Paul Diamond. I am the Residency Program Director and Chief of the PM&R Department at Westchester Medical Center. And I was recruited here to build a strong academic department. And also a priority of the place was to establish a new ACGME accredited residency training program in PM&R. And as you'll see, we've done both. Previously, I was the director of neurorehabilitation at the University of Virginia for over 20 years. I came up to New York actually at the height of the pandemic, which was terrible timing. I started in March of 2020 to serve as chair of the Department of Rehab Medicine at New York Medical College. And I am now full-time at Westchester Medical Center. I've been a residency program director 2 other times, one down at UVA and also at Metropolitan Hospital here in the city. And I also served as interim DIO, which is the head of graduate medical education for New York Medical College for about a year. So why am I at WMC? Well, Westchester Medical Center is a 652-bed tertiary quaternary acute care hospital, level 1 trauma center, comprehensive stroke center, and major teaching affiliate of New York Medical College. And the hospital treats over 120,000 patients annually. And the WMC Health Network serves more than 2.4 million individuals. And it really provides state-of-the-art care for its patients. It's a very excellent environment for developing a strong PM&R program. So WMC has a rich history of outstanding GME programs. It currently offers 18 residencies and 28 advanced fellowships with approximately 500 residents and fellows. We are a major academic affiliate of New York Medical College, which includes the schools of medicine, health sciences and practice, and the Graduate School of Biomedical Sciences, as well as the College of Dental Medicine. So the opportunities here are endless, but other than the incredible healthcare facilities and services, why am I here? Well, this is a highly collaborative and supportive environment. The collaboration between the departments really is amazing. It's fun to come to work here. The people are incredible. I enjoy every day. The health system administration is extremely supportive of PM&R, which they really see as a priority here as we create a PM&R Center of Excellence. In fact, when I was hired, the first thing they wanted me to do was apply for accreditation for a PM&R residency. So we work very, very closely with the related specialties here, namely orthopedics, neurosurgery, and neurology. We work closely together with, and all these departments really recognize the value of the care that we provide. So it's just a very positive, welcoming environment. This is a place and a program that I can be incredibly proud of. We worked hard to structure a residency training program, which is rich in learning opportunities with faculty that you can really look to as role models and mentors, and create a fun work environment where everyone supports each other and wants to see everyone succeed. And that's what we are going to want our residents to do. Now I'd like to introduce other representatives of our program. I don't know whether they were able to sign on or not, but Janelle Richards is our program manager. Dr. Jordan Stump is our associate program director and associate medical director for the inpatient rehab unit. And Dr. Anusha heads our outpatient sports medicine program. And we're also inviting Taylor Ingberg, one of our physician assistants. So I think if Dr. Stump is here, he'll begin by reviewing the basic structure of the training program.
All right, can everyone hear me?
I can.
Okay, perfect. And sorry, there was a little bit of a lag there, everyone, just because I think our institution login did not work. So we've been scrambling to log in to Zoom with different ways. We did not know that we needed to do that. So give me just 1 second to share our screen here. All right, so Dr. Diamond spoke his part. I'm going to go into this here. Can everyone see our screen? Okay, so this is just going into, obviously, we are a new program. We're going to be a new program as of next year. As Dr. Diamond mentioned earlier, we'll have our 4 PGY2 spots and our 4 PGY1 spots. We just wanted to go over the structure of our program. Obviously, it's not really out there yet because this is a completely new program. So first, to just share the PGY1 year, we, again, think that this is a pretty unique year. A lot of the classic advanced programs will have the prelim year, which are either mostly medicine, mostly surgery, or whatever else you end up choosing for a transitional year, whatever it may be. But with our categorical program, the idea is that you get a little bit of everything that could help you out in PM&R in the future. So we have half of the year going to be just in internal medicine on the floors or in the clinics. So you're seeing that there on the right, that's about 6 months. You'll get a month in emergency medicine. With neurology, you do get a month in PM&R as well to explore what we have to offer a little bit more in that PGY1 year. Additionally, you'll get to work with the orthopedic service for a month. You'll get a couple weeks of radiology, a couple weeks of rheumatology, and then the part that's cut off there is actually just the NICU. So that's the neuro ICU, to get a little bit more exposure to the more complex neuro patients that we do end up receiving on our floor, and they can be quite complex. So I think that getting that exposure in your first year will be very helpful. Moving on to the rest of PGY2 to PGY4 years, where you'll be focusing on PM&R. Similar to a lot of programs, our PGY2 year is very heavily geared towards the inpatient setting. So half of the year you'll be at the Valhalla campus acute inpatient rehab unit. That'll be 6 months with either myself or Dr. Gohari, our other attending. You'll have 3 months at the brain injury unit, and that's going to be at Burke Rehabilitation Hospital. And that's, again, a locked acquired brain injury unit. And then you'll have a couple months at Mid-Hudson Regional Hospital. That'll be also just a general rehab unit. It's a little bit farther north from us, but it's technically part of our own unit at Westchester Medical Center. We're kind of a combined unit, 18 beds and 18 beds. And then finally, the last month of your PGY2 year, you'll be at the VA down in the Bronx for your spinal cord injury rotation. Going on to PGY3 year, you're going to move into a little bit more of the outpatient setting. So you're going to get some PM&R outpatient specialty clinics, whether that be sports, whether that be a little bit of spine. You're also going to get some neuro rehab in there as well. The EMG lab you're going to have for 3 months during your PGY3 year. You will do your pediatric rotation at Blythedale Children's Hospital, and that'll be a mix of both inpatient and outpatient with the amazing physicians there. You will get a couple months of elective time during your PGY3 year, which I think is going to be very helpful for those who are trying to figure out exactly what they want to do within the field, possibly do fellowships. And then next, just for a month, you're going to have a mix of cardiopulm, prosthetics and orthotics, and then also a little bit of geriatrics. Finally, in your PGY 4-year, you're going to be heavily with interventional spine and pain, more of just the general outpatient PM&R clinics, which could include spine, pain, sports, and neuro rehab, and then EMG lab, and finally consults. And I think that's a good wrap up for PGY 4-year because you'll have a good understanding of the various aspects of PM&R at that time. So a much better time to do consults than earlier in your PM&R training. I'm going to share the next slide here. Give me just one moment. And I think that Dr. Anusha is going to talk a little bit more about some of the clinical sites.
So clinical training sites, majority of your training will be at Westchester Medical Center for both inpatient and outpatient rehabilitation medicine. Westchester Medical Center is a level 1 trauma center, and it's located in Valhalla. Mid-Hudson Regional Hospital is a level 2 trauma center, and it's located in Dutchess County. And you will be doing your inpatient rotation there as well. Burke Rehabilitation Hospital is located in White Plains, and you will be doing your brain injury rotation there on their secure brain injury unit. The James J. Peters Veterans Affairs Medical Center, otherwise known as the Bronx VA, will be where you'll be doing your SCI rotation. Blythedale Children's Hospital is where you'll be doing your pediatric rehabilitation rotation during your 3rd year. And lastly, the Grove at Valhalla Rehabilitation and Nursing Center is for subacute rehab exposure, where you'll be training on how to manage patients on the subacute side of things.
And just to add a little bit more to this, I know that a lot of people wonder about exactly the distances for some of these rotations. So again, kind of the main focus of everything, most of that initial inpatient exposure, and then most of the outpatient exposure as well, will be at the main WMC campus in Valhalla. And then just so you're aware, the bottom 2 clinical sites, both Blythedale and the Grove at Valhalla, are both within 5 to 10 minutes, probably not even 10 minutes of your main clinical site. So those 3 are within the very same area. Burke Rehab Hospital is a 15-minute drive away. The James J. Peter Veterans Affairs Medical Center is going to be about a 30-minute drive. And then Mid-Hudson Regional Hospital is just about an hour drive north of where Westchester is. And again, you're there for 2 months and you're at the VA for just 1 month. So you do have a little bit of driving, but pretty minimal compared to how some of the programs are spread out. I'm just going to go on to our last slide here. All right. So our very last slide, we just wanted everyone to get an idea, again, because we are a new program, just to show what the kind of the more educational schedule might be. So the way that we have didactics planned out right now, we would have Monday afternoon didactics, and that would be from 1 to 4 o'clock in the afternoon. And then basically each day there would be some sort of education, again, to give you the most educational experience that we possibly can. So on Tuesdays, we're going to do a mix of journal club, grand rounds, and then challenging case presentations with some of the more senior attendings. Additionally, on Wednesdays, we're going to end up doing neuro radiology and then MSK radiology, both very important to our field. On Thursdays, and not every Thursday, we're going to mix it up between program directors meetings and then some QI project meetings. And then lastly, on Fridays, we're going to have a slew of different types of meetings that include some wellness lunches, other wellness events, some mentor-mentee, different scenarios there that you can talk with some of the older residents or some of the newer attendings when we have our program at first. And then our program evaluation committee meeting may be on the Fridays as well. And the way that we're going to split up our didactics, it's going to be by system. So we'll have some neuro rehab. We will split it up between we'll have pain. We will have more of our MSK section, P&O. It's going to be set up, trying to do month by month. I'm going to unshare my screen and hopefully you can see all of our faces now. And we did want to leave time for about at least 5 minutes for questions. I think we did that. So if anyone has questions that they want to ask out loud, feel free.
We are at about 5 minutes.
You can also message the questions as well. I did want to mention that for the rotations that are not on the campus at Valhalla, we are going to be reimbursing residents for their mileage, which I know is often a question. And
Okay, and I see a couple other questions here. So it says, would it be possible for medical students to join Didactics virtually? I'm not sure if that means the residents or medical students, but the plan would definitely be to join some Didactics virtually, because we will have some people who are on those outside rotations. So there will be a hybrid of having both a virtual and in-person didactic. And then what else do we have here? Are there any outpatient rotations in PGY 2-year? As of right now, it's PGY 2-year is all inpatient.
there is when you're at Mid-Hudson, there you do actually spend some
Sure.
time in the outpatient clinic there, and that actually gives you an opportunity to do some EMGs, a little bit of Botox before the clock is really ticking in terms of the PGY 3 and 4 years. So we're very confident that we're going to give our resident trainees the opportunity to do plenty of procedures, whether it's ultrasound guided, Botox injections, EMGs, nerve conduction studies, et cetera. We also have a very strong interventional spine program in collaboration with pain management, so there will be ample opportunity to do fluoroscopically guided procedures.
Then I see a few other questions here. So I'm going back to the top because I think we skipped one. So there's one that says, what is the call schedule? It's going to be, we're going to figure things out kind of as we go, because that first year there's only going to be 4 PGY2s. So they're not going to be constantly on call. We understand that that is not possible. It is going to be home call, and the only call will be for our main WMC Valhalla inpatient rehab, our 18-bed unit. So we are working on what exactly that call schedule is going to be like, especially because at first there's not going to be enough of you to do a true call schedule. And then the housing for farther rotations, the VA will not have housing. That is technically a closer rotation, and they have plenty of parking and things there. I rotated there when I was in residency at a separate place. And then Mid-Hudson, there is, Dr. Diamond, as far as I'm aware, there is actually going to be housing available for the residents when they do have to go up to Mid-Hudson, because that hour trek is a little bit farther than the kind of classic way that you would do your rotations. What else do we have? Do you have a sports med rotation? Dr. Anusha here is one of our sports medicine attendings. So
Yes,
she will be leading you.
Right. Yeah, I think we still have to put some things in place. We're about to start our sports medicine clinic soon, as in we will be starting to see patients next week and then gradually build the program. So by the time you get here, there should be a plan in place for you to be able to do a sports medicine rotation. And I think there was another question about feedback. What systems will be in place to respond to feedback from the residents? Our program chair, Dr. Diamond, he has an open door policy. And Dr. Diamond, would you like to answer that question?
It's, tell me the question again.
What systems will be in place to respond to feedback from the residents?
Oh, well, it's actually going to be, it's really a priority for us to get the input of everyone, both the residents and the faculty, in terms of the program and how it's doing. So we have a very extensive evaluation process in place where the residents will be giving confidential feedback on the rotations and the faculty that they're working with. We're going to have regular meetings. The program director has regular meetings with the residents every month, which is basically an opportunity to discuss the program and how we can improve it. And residents will also be represented on the program evaluation committee. So we'll have a resident from each training year on that committee, meeting with the faculty who are on that committee to discuss ways to improve the residency further. That's been my experience over the years. It's been incredibly helpful to get the residents involved in really developing the program and improving it over time. So it's very important and a great question.
I think that wraps it up for us for this session. Thank you all so much for taking the time to present. This is really awesome to this new program. Thank you.
Absolutely, our pleasure.
Thank you.
Thank you.